At Garcia Facial Plastic Surgery, we have several requirements that we ask our patients to fulfill prior to their surgical procedure. The first one is we ask anybody over 45 years old to have an electrocardiogram that is within a couple of months of age, in addition to a medical clearance from their family doctor. We usually leave it up to the family doctor or to the internist to decide on which blood tests they want to draw from the patient. We work in cooperation with many primary physicians, and we have very good working relationships with many primary physicians in the area. If a patient doesn't have a primary doctor, we have several people that we can refer our patients to. In addition to the pre-medical clearance and the EKG, all of our patients are evaluated by our anesthesia personnel prior to surgery. So there's really several layers of safety to ensure that the patient can undergo an elective cosmetic surgery procedure in a safe fashion. Our operating room is accredited by the state of Florida. That means that the Department of Health comes in every year and accredits us to be a safe provider with regards to office-based surgery. They come in every year and they inspect us physically. Their inspection ensures that we have adequate policies and procedures, from anything to patient safety to proper equipment and proper medications. We're also required to have emergency backup generators in this facility should the power ever go out. In addition to that, we're also required to have certain equipment such as defibrillators and medications in case a medical emergency should arise in our facility. We have, in addition to all of this, a transfer agreement with any hospital that fortunately we've never had to exercise, but should a medical emergency arise during one of our procedures, we can transfer the patient very quickly using EMS to a local hospital. In addition to all of our safety protocols in the operating room, all patients are reassured at this facility that there is always a group of 4 people in the operating room at all times during their procedure. I have an anesthesia provider responsible for their anesthetic level and responsible for the patient's level of comfort. I have a registered nurse in the operating room in addition to that at all times, as well as myself performing the procedure, as well as my assistants. So there's a core group with the patient at all times during the procedure to ensure the patient's safety and their comfort. One of the things that sets us apart is the fact that I see all of my patients at every post-operative appointment. Patients are required to come into the office frequently after their procedure. I typically see patients the day after the procedure, at a week after the procedure, at 2 weeks after the procedure, a month, 3 months, 6 months, and a year. In addition to being included within your surgical fee, I see all of my patients at those visits. And that ensures comfort for the patient, reassurance for the patient, but also should there be any problem or any situation, we typically catch those problems in their early phases and we intervene early, thus ensuring a good resolution of those problems.